the majority of the population of total knee patients in the United States is morbidly obese. And it is very difficult to get a complete exsanguination of an obese patient. And the other issue is it's hard to fit a tourniquet around a very bulbous leg so that it doesn't slip down to the knee. With the HemaClear, we can apply it to the leg, get perfect exsanguination that an S-mark bandage would never really be able to get, and then it stays in the right position so it doesn't slide down. And because of its application, it gives us a larger surgical field to do our total knee replacement.
Works very well for me. I use it most commonly with my obese patients because those are very much the more difficult folks to deal with, because the tourniquets on a regular basis are sometimes hard to keep inflated when you're especially going from flexion extension. And so I find that those patients, when you're in the middle of a case and you're trying to fit the implant in properly, it's difficult to keep a standard tourniquet inflated. And so even if you have a high pressure, whereas if you use the HemaClear, it stays perfectly inflated the whole time, or keeps that constant pressure that you're looking for.
In the United States, workflow must be improved. Part of it is because of diminished reimbursements to physicians and hospitals. So throughput in an operating room is very important. And to do that, we do time motion studies to see even an operating room, it costs about $25 to $35 a minute. So if it's going to take you an extra 2 minutes in that operating room to put on a tourniquet, and then with a S-mark bandage, which now are latex free and are very difficult to keep up on the leg, this is actually, the HemaClear goes on rapidly, and again, it stays in the correct position. You have an operative field that is clear of bleeding. The varicose veins are completely exsanguinated, so you can actually see their lumens, and you get better exposure, a more rapid exposure, and you can delineate the different structures, and thus you have a much cleaner surgery, and the tissues are handled with more precision. I have residents from the University of Illinois. While we're doing the surgery, the residents have stated to me, Dr. Goldstein, this surgical field is so clear, it's almost like you're operating on a cadaver, because there's no blood that we have to wipe away or suck away, and the operation is clearer for them. They can see the surgical structures instead of constantly sucking away the blood that was supposed to be exsanguinated. They can actually see the very subtle structures that I'm pointing out, such that in a total knee, we electrocoagulate the lateral geniculate artery, which most of the time is missed, and other doctors have to let it down, let it bleed to find it. You can actually see it so clear, and you can actually electrocoagulate it, and thus we don't have any postoperative bleeding. When you do a total knee replacement, the cleanliness is the issue. We generally, in many of our hospitals, reuse tourniquets. And we must realize that those tourniquets are not in a clean place on the patient's body. They are sitting up by the groin and in the perineal area, which is loaded with bacteria that come from the gastrointestinal tract and the genitourinary tract, and thus it is highly contaminated. The issue is, if patients really knew that that was removed from a patient prior to them, and the same tourniquet was going to be used on them with little more than wiping it down per se. It's the same kind of issue of wearing somebody else's underwear, or even an unclean person being on a toilet and then you having to sit down. At least we have covers now in public toilets. But this, if the patients really knew, would be unacceptable to use somebody else's tourniquet. And HemaClear is fresh, it's clean, and it actually doesn't have any of those issues.
I find that it's the ease of application. It's very user-friendly. It's something that we apply, at the beginning of the case. It stays up constantly. I really like the sterile sleeve that comes with the whole system, and that you put that on at the very beginning. It stays throughout the case, and it gives you an opportunity to keep the whole field sterile throughout the operation, not only from a blood standpoint, but also from an infection standpoint. With the standard tourniquet, you're putting it on, just on the thigh before the case starts, and then you drape around it. And with this, you go ahead and prep and drape the patient, then you apply it, and it allows you to keep the field sterile throughout the operation. I have plenty of room, when we use the HemaClear. I mean, you can get it up very proximal on the thigh. It doesn't give you that big bulky area that you get with a standard tourniquet, and so it works out very well to keep your exposure throughout the operation. There's more limited blood loss, so they don't have to worry necessarily as much about transfusions after the operation, and it's just a nice, overall comfortable scenario for the patient and for the doctor.